An EHCP is an education healthcare plan. EHCPs replace the old statement of special educational needs. The idea is that it takes a more holistic approach towards a child's needs, so it covers their education, their healthcare and their social care needs. In the past, hours were allocated to a young person that had a statement of special educational needs, but with an EHCP what happens is a pot of money is allocated, so schools can buy in services where and when they're needed. Schools, as part of their standard offer, they have funding of £6,000 allocated to each child. So a child that has special educational needs or disabilities and those needs can't be met by the school in their budget or with their staff, then we can apply for an EHCP to actually get additional funding for that child. An EHCP could benefit a child because it will give them that extra support that they need. They may be able to be taken out in small groups, they may be able to have some extra one-to-one support, they might be able to have things like speech and language support, support for their social emotional needs. An EHCP will also name a specialist educational provision, so it may be a mainstream school with an additionally resource provision, it might be an independent school, but to go to any sort of specialist school you're required to have an EHCP, so it can actually get them the support they really need and direct the support in the right direction. If a school or a foster carer believes that a child might benefit from an EHCP plan, what will happen is they will approach the local authority and say that they would like to assess. And then the local authority has to respond to say whether they will agree to an assessment. At that stage, we will gather evidence. So we'll gather evidence from teaching staff, from foster carers, maybe from speech and language therapists, educational psychologists. The information will be gathered and then that will be sent off. The plan will be then drafted, so it will be a draft document which will then be distributed as a draft document. Everyone involved in the process will then have a chance to respond, so they have a certain amount of time to respond to say whether they agree with the document or not. Changes will be made and then it will be issued as a document. The whole process should take 20 weeks from beginning to end, but it can take an awful lot longer. The schools would actually do the bulk of the work. The SENCO, or the designated teacher, they would do the bulk of the work, but they would actually obviously ask for foster carers' views, they might ask for our views, they would ask for views of other professionals, other specialists. So it could be an educational psychologist, it could be a speech and language therapist, it could be a psychotherapist. So all professionals that can actually add to the document and actually help to sort of get the document produced for the young person. So an EHCP will last up to the age of 25, which is very different to the old statement of educational needs. So even when a young person has left care, the EHCP is still in place. It can be transferred into college, it can be transferred into apprenticeships, but it cannot be transferred into university education. Each year an annual review of an EHCP takes place. Professionals are invited to the meeting, which is held at the school. They will meet to discuss the EHCP and there may be three outcomes. One can be that the document remains as it is. The second will be that the document is amended and updated if a child or young person's needs change. The third, the EHCP could be ended. It's very unusual for that to happen, but if it is deemed that a child no longer needs an EHCP, then the document can be ended. If that decision is made and professionals do not agree with it, then that can be appealed. But I mean, that can happen when a child possibly leaves education, so that might be one reason. But there is an appeal process if professionals don't agree with that.